Greetings. This is Justin Allen, the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show, a podcast dedicated to nurse practitioner entrepreneurism and achieving financial freedom, where I talk directly with nurse practitioners who need help. Listen up, our market is saturated. Jobs can be scarce. We are underpaid. We are undervalued. We are taken advantage of by the sharks within the healthcare system. And frankly, screw that. Sick of it. And it's time for a change. And listen, I'm here to help make that happen. We are powerful. We can forge a path where we are in control of our career and ultimately our financial and personal well-being. You do not need to submit to healthcare administrators and your doctor overlords. You do not have to take the measly salary. You do not have to work 50 to 60 hours a week. There is a different way, and I'm here to show you that path. This podcast is raw and unfiltered. I have not talked with the nurse practitioners in this podcast prior to the call outside of an email exchange to schedule the episode. What you're about to listen to is a consultation session between a nurse practitioner and myself. It is real, it is unscripted, it is unplanned, and I have no idea what we're going to talk about. Anything and everything can happen during our conversation. The nurse practitioners in these episodes are struggling with an issue in their professional or financial life, and they have reached out to me for help. My goal is to help a nurse practitioner with actionable advice that will enhance and improve their professional, business, and financial life. My other goal is to hopefully help my nurse practitioner sisters and brothers build a more productive, powerful, and free life. So I hope the content and information within these podcast episodes does just that. All right, onto the episode. Everyone, today we'll be talking to Joe, who is a psych nurse practitioner. Currently, he is operating his own telepsych practice where he provides services for ADHD, anxiety, depression, and PTSD. He states business currently is pretty healthy as a solo practitioner, but he is needing assistance with developing his high-ticket concierge practice, growing the practice in general, and how to integrate some new services into the practice from more of a cash-based perspective. So, hey, Joe, how are you?
I'm doing great. Thank you. How you doing?
Doing good, man. Thanks for hopping on here. So, yeah, tell us about yourself. How long you been in NP for, and I guess kind of how you got started doing your own thing.
Yeah, sure. So to back up a bit further, I started from the ground up. Like I started as a certified nurse's aide, and then did that as I was getting my associate's RN degree, working at a local community hospital emergency department. From there, I went and got my bachelor's at UMass Boston, and then eventually to Northeastern, where I got my master's as a psych NP. And my first NP job was with a group practice here in Boston, Mass. There was primarily like a therapy practice, but then later expanded to include medication management, which is where I came in. And this was, I started working as an NP in 2019, so like right before COVID hit. I think I worked in the office for probably a total of like 2 or 3 months before everyone was working remotely, right? So about, I want to say somewhere like 2.5 years into working with this company, I eventually asked my boss, thinking about it, like I'm providing like all my own office space. I'm doing all my own scheduling, my own billing, like I'm doing it all. He's not really providing that much for me. I asked for a raise and he gave me the best answer he could have given me. He said no. So literally the next day, that's when I started working on building Journey Psychiatric Care, my own practice. And that, I didn't put any pressure on myself. That probably took me about maybe like a year or so, still working for that group practice and little by slow building up my client base. And then eventually I took that leap of faith and quit that group practice. And I've been fully self-employed now for about, I think I'm going on 3 years now.
Nice.
Yeah.
Hell yeah.
Yeah.
Cool.
It's been quite an adventure.
Yeah, good for you. So, really big chunk of your MP career that has just been you being employed.
Yeah.
Of your self-employed rather. Yeah. Okay, so then the business, is this cash only or is it insurance as well?
No, it's primarily insurance. I take all major insurances. I probably have about somewhere between half dozen, a dozen or so clients who pay cash just because they prefer to stay with me rather than go to one of their like in-network providers, or like if they don't have insurance or something. Um, but yeah, primarily insurance based, which, as we all know, is a hassle and a pain in the butt. Yeah. So, as I mentioned to you in email, I'm realizing that I've completely gotten over my imposter syndrome, right? And I'm actually pretty good at what I do. Um, and what are the metrics for that, right? I Google reviews are great that I've got from folks. Um, I probably have a caseload of about 250 or so patients. Um, but I have some of my patients, like the mom who has referred her children to me, or the patient who has referred their partner to me. That's how I know I'm doing something right. So I'm providing this level of service to my current insurance paying clients, and I'm looking for your help to hopefully identify, you know, wealthy individuals who would appreciate this level of service. So, like this concierge psych service, who don't want to deal with the insurance bill and are willing to pay because they can afford it, and like, pay cash or whatever.
Right.
Because I'm really just looking to pay off my 180 grand in student loans,
Oh.
and
Yeah.
have some more financial freedom.
Right, right. Okay, so then the insurance component of it's doing well. Now, let me ask you why. I mean, you're only in one state, correct? You're
Yeah.
only seeing patients in one state right now.
Yep.
Yeah. Okay. Um, and you're in a pretty affluent area. It sounds like for the most part. I mean, people have good jobs and there's money and stuff.
Yeah,
Um,
Massachusetts is one of the most expensive places in the country to live.
right.
Boston. So a lot of my clients are like Somerville, Cambridge, Boston, Greater Boston area, but like all throughout the state, really.
Yeah. Yeah. So that's not really an issue there. So I guess we can go about this two ways. I'm thinking. So if you want to develop some more financial independence, then yeah, you can integrate some concierge services into your practice, some high ticket concierge services. Um, while still continue to do the insurance stuff. Cause I mean, the insurance stuff, I mean, you're doing well. I mean, why you
Yeah,
don't want to stop that, obviously, right? So
exactly.
yeah, yeah,
I'd love to like maintain that. And then I'm thinking, maybe I would need like a half dozen to a dozen of these other
yeah,
folks who can like really afford to pay cash, and like maybe these are people who would like have my cell phone number, for example.
yeah.
We'll just have that like next level of service.
Correct. Yeah, exactly. So let's think about this two different ways here. So you have a practice that's doing well right now. Out of curiosity, before I continue,
Sure.
revenue wise on a monthly basis, estimated, and we don't need an exact number here, but
Monthly basis. Well, I'll tell you, annually, probably about 250,
okay,
250,000 I generate.
okay,
And
okay. So
over
20,000 a month, give or take. Yeah,
yeah,
yeah. Which is, dude, that's pretty good for being an NP. I mean, that's
I'm I'm not complaining. I'm in love with my practice. I love what I do. Like, uh, yeah, it's
yeah.
unfortunate.
Are you seeing patients 5 days a week? What's your schedule like?
No, man. Like Monday, Tuesday, Wednesday, I see patients. I reserve Thursday and Friday for administrative stuff, catching up on my notes, whatever. Um, but I started using AI Scribe, so that's helped out a lot. Um, so like prior authorization, both from like, yeah, what we don't need to get into
Yeah.
that. Like we know that hassle. So yeah, like 3 days a week are my client facing days.
So how many hours a week do you put into this practice?
So I see patients usually have full days, Monday, Tuesday, Wednesday, from like 9 to 4, a little bit after. Um, uh, and then I don't know, I'd say probably an additional 10 or so hours a week with like refill requests and all the other stuff.
So you are working less than 40 hours a week. Yeah. All right. You're working less than 40 hours a week, making $250,000 a year. It's really good. So,
Yeah,
we obviously don't want to do anything to break what's working, right? Um, so let's go about this two different ways. Number one is, yeah, you can create a high ticket concierge thing, which ultimately is going to it's going to give you more work, right? It's going to increase your, hourly, uh, your hourly responsibility to the business. So
sure.
you can go that route. It gives you more work to do, right? But those clients overall, high ticket stuff, high ticket concierge stuff, people oftentimes think that they're going to get these patients who have your number and, they're going to text you for things and, et cetera. Oftentimes with these high ticket kind of things, these people are busy. They have businesses. They're high functioning professionals. They're not going to really bother you that much, but they like the convenience and they like the red carpet kind of treatment when they need help, they get it
Yeah.
fairly quick,
The
same day kind of
knowing
thing.
that's there. Yeah. Right.
Yeah, yeah. So, if you have a dozen of these people, then, how many hours extra a week is it going to be? I mean, probably in reality, man, three, like it's not going to be that much. Um, so you can do that, but ultimately at the end of the day, though, the business is still 100% reliant on you, right? So you have an insurance practice right now that's generating very, very healthy income for you. So I think you want to think about also scaling what you have in addition to doing the high ticket thing. So,
Sure.
you can integrate other services into your practice and stuff like that, but ultimately at the end of the day, still it's still requiring your input with it, right? So I think that you want to think about this two ways. I think you want to think about how do I scale what I have now, this model that I've developed? How do I scale this? And then also get some of this stuff off my plate, more of this busy work stuff, this insurance based stuff, get some of this off my plate and focus on what I really want to focus on is more of that one-on-one concierge kind of stuff. So I think that's the way I would approach this. So with that said, you have an insurance-based model. So let's talk about that first. So
Cool.
um, what's preventing you from hiring another NP, PRN, 10 hours a week or something to start beginning seeing patients for you?
The only thing really is along my nursing journey, I've worked in management. I was the manager of a dual diagnosis unit at an inpatient psych hospital in Boston for a bit. I also worked as the director of education for that hospital for a few years, and I, you know, I don't really want to manage people, even with professional NPs like ourselves. There's going to be stuff that comes up, and that's like a little bit of a headache, but I mean, if the juice is worth the squeeze, I'm willing to go that route. Um, and I've kind of started going down that path a bit in terms of like I'm precepting psych NP students. So like they're with me for like, a couple days a week, just observing everything, right? So these are people who like they don't have any habits. They can learn my way of doing things. And, like those are the kind of people rather than just sort of taking a look at someone's resume, someone I don't know, and hiring that person. Maybe I'm a little bit of a control freak. I don't know. But yeah, I mean that totally makes sense and something I do intend on doing. And what's funny enough is some of the people I went to school with getting my associate's degree they've gone on and like FNPs, and now they're like going for their psych NPs because they want to move in that direction. And so, like one of my buddies, I'm going to be precepting him when it's his rotation. So that's a potential person I would hire. Um, and then another friend of mine, Laura, same deal. She's doing the same thing. I offered the same thing to precept her. These are the people I would like to, because like my practice is my baby. Like
Right.
I want to make sure I have good people that I can trust, and I don't have to manage. You know what I mean?
Yeah. So giving up the control is probably one of the biggest things that prevents any business owner from taking their business to the next level. Okay.
Okay.
That's something you just got to get over, man. Like
Yeah.
you got to get over that. You have to. There's no way you're gonna grow a business that works for you
Yeah.
without giving that. You have to give that up because if you don't, the business will never work for you. You'll always be 100% tied to it. You'll be a control freak, and honestly, you'll make your employees' lives probably kind of miserable.
Right.
So yeah. So you've got to let go of that responsibility and learn how to trust other people. Which I hate to say this, some people are going to do fantastic, and some people are going to fuck you over. That's part of it. I've been over almost every business I've ever had. Someone has fucked me over,
Yeah.
but I also have some great people that work with me and work for me.
Sure.
So it's just something it's part of the game, right? I mean, if this was an easy thing, everyone would scale $1 million business.
Yes.
So yeah, so you have to be willing to deal with the headaches. Now, the management component of it, man, managing some providers is really not that hard. You'd be surprised for the most part, man. They kind of just do their thing.
Okay.
You have to manage them from a schedule perspective. Hey, what hours you want to give me this week so I can schedule patients on you? Okay, you're going to go on vacation for a week. Fine. It's just little things like that, man. It's not really that big of a deal.
Yeah.
Um, you can have a virtual assistant that can do that for you. Um,
Yep.
so so yeah, I wouldn't I think there's a lot of limiting beliefs there. I'd say you can pretty much scrap most of them. I think the big thing here is finding someone you can trust, right? Someone that you can mold into what you want. So you have these psych NP students. I know another psych NP. I won't say what his name is, but this other psych NP, what he does is he brings these psych students into his practice to precept, and has them see almost all of his patients for him.
Uh-huh.
And he just signs off on the charts and signs the prescriptions. So like the psych NP students are getting him free labor.
That
And
was by fire. Yeah.
yeah, like it's a genius model. He has
Yeah.
free labor, right? While he's teaching people and stuff. But so if you get a psych NP student that comes in, um, the issue is when they get out, they're gonna expect a full-time job, and that's something that you probably won't be able to do quite yet. But you should be able to at least give one of these people at least 10 hours a week. Now it's
Start
gonna be a
out
hit to
pro.
your income. Like you have to you just gotta accept that fact, okay? Your income will drop a little bit, all right? It will for a little while, and then it'll rebound and be even more, okay? So there's a little bit of a dip, and then it'll go back up, okay? So if you're generating $250,000 a year, your margin, I don't know, your margin on this is probably what, 90%, 95%?
Yeah, there's not a lot of overhead.
Yeah, right. So you have a huge margin here. So when you hire another psych NP to start seeing patients for you, cut it by 25%. That's about what you're gonna have to pay them. It's about 25 to 40% in that range, depending on how generous you want to be. Okay. So it'll be cut in half. So let's just say as an example, let's say you go more like the 40% route. Okay.
Okay.
You give them 40% of collections, right? You give them 40%. The other 10 or 20% covers expenses, and the other 40% is profit for you. So basically, you're getting 50% essentially, right, for free for not doing anything. So you as the business owner now collects 50% versus the 100% when it's required for you to see the patient, right? So when someone else sees the patient, you collect 50 versus the 100. Okay.
Okay.
You can see how that can scale very quickly, right? Like you bring two NPs in, and let's just say as an example, a year from now, 2 years from now, you have two MPs working for you,
Mhm.
and they're seeing patients on a full-time basis. You now are making $250,000 a year for not doing anything. They basically replaced your salary. So you make $250,000 a year for doing nothing. And then you continue to see your own patients over here.
Yeah.
If you still want to work because you like doing what you do, you're making another $250,000. So I mean, you're making almost $500,000 a year at that point, right? So yeah, you can see how this thing can scale. So I mean, you can bring in high ticket concierge, but it still requires your time. So I feel like that you should test the waters with it. Okay, I'm not asking you to hire someone part time or even full time or even part time right now. Test the waters.
Yep.
Bring in someone just to see patients for you for 5 hours a week. Just be like, listen, I need someone to come in PRN. You tell me what your schedule is. I will schedule patients based on your schedule. Okay.
Uh-huh.
I'll pay you 40%. It's great money. You'll average about $100 an hour, give or take, or whatever. You figure out that math. You average about $100 an hour. I need 5 hours a week. It's easy money for you. I just need, this is what I need, just basic medication management stuff. I have these established patients. They just need refills and stuff. You know what I mean? I'll
Cool.
fill the eat to them,
Yep.
right?
Yep.
I say try it and see the power of leveraging the work of other people in your business. Actually experience that. Because once you experience that, what happens is you'll see that and you'll be like, I'm going to really go in on this. And then you end up becoming like myself and other, other entrepreneurs. 5 years from down the road, you become a lazy. So yeah. So anyways, though, but yeah, but that's just how it goes, though. You take all those risks, so you become, so you can become lazy later on, right? So, um, but anyways, I say just give it a try, man. See how that goes, because you might be able to like really scale that very quickly. I don't know what the demand is in your area. I don't know how long of a wait people are, just to establish care with you, that sort of a thing. So,
Mhm.
so yeah.
Okay. Um, Actually, another thing that I would need to do, I think, is I don't know if I told you this before, but I currently use Headway for all my billing stuff.
Yeah.
So I know that's not the ideal for me. It makes it super easy because like they take care of checking client benefits, collecting copays, all that stuff that I don't want to deal with. So you know, I think I'd have to go through the process of like getting rid of them, hiring a billing, outsourcing a billing company, um, to like do all that stuff. And I've had like a couple billers in the past with like not the greatest experience, which is surprising because like they're getting paid off of what they're collecting. So
Right.
it's a matter of I
Hey,
guess finding like a quality billing company and stuff like that too.
yeah, right. I mean, yeah, you would think these people would care. That's how they get paid, but
Yeah,
to
that's why I'm more
them,
interested in the cash thing, the
yeah,
concierge
yeah.
type thing.
Problem with a medical billing company is that, they make 5% or whatever, right? 5%, give or take.
Yeah.
And to them, dealing with a 1 hour denial or whatever is not worth the 5% to them. It's for a $200 bill and make $10 off that. It's not worth their time. They let it go.
Yeah.
Right? That's the problem with billers. Okay. They just want the easy, low hanging. That's the easy 5%. But then when it comes to denials and stuff like that, they are not going to spend their time for $10. They're just not going to.
Mhm.
It's you over, you just $190 is down the drain now.
Yeah.
To them, they don't care. Right. Now, Headway, on the other hand, they do care about that stuff, right? Because I mean, they're pinching every piece of margin at all the margin they can out of this thing.
Yep.
So with Headway, and you probably heard this on another podcast before, but like the issue with Headway is that they technically own those patients. So look at your contract. Okay, I don't know if they've changed things or not, but take a look at your contract and see if they actually own those patients or not, because they're the ones providing the patients to you and everything, right?
No, a lot of these patients come to me. I don't do any marketing other than like I have my own website and I have a page on psychologytoday.com. Other than that, it's word of mouth. I actually have my settings on Headway that I'm not accepting new patients because there was an issue with like syncing up my calendar, whatever. We don't need to get into that, but I do not get referrals from Headway. I do get
Okay.
referrals from like Blue Cross Blue Shield, which I'm directly credentialed with, um, and stuff like that. Word of mouth mostly.
Okay, so then so then those patients should be yours. Just make sure you verify it. Because I think with Headway, it's the patients that they send you, that they give you. That's technically their patients. But if these patients are yours, you're just using them for billing. I don't know how that complicates it. So you might want to just take a look at those details in
Okay.
the contract and stuff. Just get the contract, throw it into Gemini or Claude or whatever, and tell the circumstances of what you're thinking about doing and make sure that this is something you can do. Okay.
Yeah.
Now, the problem with Headway is that if they do provide you the patients, which a lot of practices is they rely on Headway to send them patients and do the billing and do everything, right? In that circumstance, they own the patients. So if you ever decided that you wanted to sell this practice later on, it might make it difficult because, you technically don't own those patients. So it
I
could
see
make,
what you're saying, but like the way I do it when I set it up is like I input all of my patient's information into the Headway platform because these are folks that like I have my own EMR. I don't put anything into Headway except for the claim. all my note documentation stuff is in my own EMR. And that's like one thing that Headway has you attest to, that, if an insurance company does an audit, you are responsible for providing documentation within 3 business days, or we'll kick you off our platform. And you have to attest to that each time you submit a claim. So that's how I do that. And I know the rules of the game.
Okay. So then you're just using them for billing, then, so it shouldn't be a problem,
That's it.
right?
Yeah.
How much are they taking? What's their cut?
I don't know. And what's funny is I won't say the exact numbers because I'm not supposed to, but like my rate that I would get with insurance company X directly that I'm credentialed with is a few bucks less than the rate that Hedwig gives me with that same insurance company for the same billing codes. But that few bucks times X amount of patients in a week times a year adds up to a lot.
Well, yeah. I mean, if it's 1,000 claims you submit and it's $5, it's $5,000 in your pocket. I mean, yeah. So, yeah. Okay. Well, listen, man. I mean, if you're happy with Headway right now, okay, you can scale a business with them for sure. All right. They're just doing the billing for you, and they don't actually own your patients. In my opinion, dude, like, why try to fix something that's not broke at all? You're making good money. They're handling all that bull for you. Like, I would just, if it was my business, I think I would just stay with them just because it makes it so easy.
Want to, yeah.
You're right. And then just hire another NP and throw them into Headway, whatever you got to do to get them in there so they can start seeing patients.
Yep.
And just keep using them. If you want to sell this business 10 years from now or something, and if Headway doesn't own your patients, it really shouldn't be an issue whatsoever. They're just doing the medical billing for you.
Yeah.
You know?
Headway did all my credentialing too. So I credentialed directly with one insurance company. They credentialed me with an entire panel of all the other major players, which opened me up to, another like market. So
Yeah.
yeah.
So I would just stick with them then. I wouldn't worry about it. Just like I said again, just make sure that 2 things you're gonna want to make sure is that you own the patients. And it sounds like you do. You're just using them for billing.
Mhm.
Make sure you own the patients, and make sure that if you do want to sell this thing later down the road, that the contract, should carry over with the new owner. In theory, I mean, that shouldn't be a problem. They would just sign a new contract with them or whatever, so that shouldn't be an issue. But yeah, those are gonna be the 2 things you want to worry about if you ever decide to sell this and you're using Headway. But if you don't want to sell it, then it's not anything you want to need to worry about whatsoever. But if you do want to sell it
Well,
later down the road, 10 years from now,
yeah.
you're going to have to hire other people. No one's going to buy your business if it's 100% reliant on you. Nobody will.
Sure.
Okay.
Yeah.
Yeah. So no one will buy your business if it's 30% reliant on you. Okay. You need to get down to 20%. You need to get down to you are seeing 20% of the patients.
Yeah.
So,
I know I
you know,
definitely need to get like a virtual medical receptionist because, like I can do without that headache of like,
yeah. Yeah,
all that stuff.
that's an easy low-hanging fruit kind of a thing. Just
Mhm.
hire a VA and call it a day and have them do all of that stuff for you. You can hire a VA that can do a lot of just the basic management stuff for you. So if you hire an NP to do work for you, this person can manage, schedule the providers. They can do all of that stuff for you. You don't have to worry about it, right?
Yeah.
Um, so yeah, anyways, I put some thought into those 2 things. If you want to scale this thing, you're gonna have to just accept getting a responsibility over to some other people. And if you pay them well, you don't got to worry about them over. If you hire an MP, then they sign non-solicitation clause, non-compete clauses. Even though this stuff might not be enforceable, it scares them. So
Right.
you put them golden handcuffs on them so they don't leave. They're not going to find a better deal anywhere else. If they want to
Yeah.
start their own practice, then start your own practice. Good luck, but you can't take the patients. You just can't. All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all Elite Nurse Practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and the other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode.
That group practice that I started working for as an NP, my split at the time was 65-35. And, I thought I was justified in asking for a raise since I'm not using the office space and, whatever else. Again, glad I got the answer no, because that's what brought me to where I am today. But yeah, I think that would be a fair, split for NPs, or even like a 60-40 to start out with, like if they're new, whatever.
Right, they get 40.
Yeah.
Right, yeah.
Excuse me, 65-35 if they're new, 60-40 if they're more experienced, something like that. Yeah.
Yeah, and the thing is too, man, start them off at 40%, 35%, whatever, 35-40% of collections.
Yep.
And if you get someone, man, that's good, you don't have to ever worry about or think about them. They've been with you for a year. They go full time. They have 500 patients or whatever.
Yeah.
To keep them, go up to 50 if you got to. You're still making money, So don't penny pinch when you got someone who's
Right.
good. It's not worth the fight, the hassle. They want a little bit of a raise, give them a little bit of a raise.
Yeah.
Yeah. Up to a point. Once you get to the point, be like, I can't give you any more money. I can't at this point. Like, I'm sorry,
Sure. Yeah.
Bonus here or there or whatever, but okay, so do you have any other questions about the scaling component of this stuff? Like that?
I don't think so.
Okay, so let's talk about the high ticket concierge things. We're talking about two directions you can take, and that one took 25 minutes. So
Wow.
this is gonna be a little bit of a longer episode. All right, so the high ticket concierge things. So tell me what you are thinking about what you want this to be. Like, what's your goal here? What's your vision?
Yeah. So, I mean, again, it's like providing the same level of service that I'm already providing to my current patients. Just that, like I said, these people have my cell phone number. They know that they can get directly in touch with me. And then, again, I'm not looking to obviously do anything out of my scope of practice or anything like that. But they would just get that for me, when I reach out to my PCP, shoot a message on my chart or whatever, sometimes it takes me a week to get a response or something like that. No, these people are getting a response within 24 hours. And I think that's worth it to some individuals,
Right. Okay.
So that.
Okay, so just a very personalized thing. So now the level of personalization and the level of the concierge kind of component of this is going to depend on what you're charging. Okay. So, if you charge $250 a month or whatever, then it's going to be a lot lower value than compared to 1,000, right? So you got to think about what do you want to charge for this? I mean, for someone who's just wanting kind of their ADHD managed and that's kind of it, and they don't really have a lot of questions for you and stuff. I mean, I think $1,000 is going to be a pretty hard ask.
Yeah.
Okay. So like myself as an example, if I was to go to you, I wouldn't bother you. Very, very, I'd be like, hey, Joe, I need a refill.
Yeah.
Hey, this stuff is making me feel weird. Just something it would just be, you wouldn't hear much from me. Right.
Yeah.
Like as long as my refills were always there, you wouldn't hear much from me. So for me, I wouldn't pay $1,000 for something like that. I'd pay $200. That'd be no problem whatsoever. Right. I pay $200 a month. Don't got to worry about it. I can talk to you, kind of make an appointment, see you same week kind of a thing. My refills are always there. I don't have to sit or chase you down for, my refill on my, Adderall or whatever. That would be nice. I'd pay $200 a month for that.
Yeah.
So for $1,000 a month, though, you're going to have to really think about how can you really beef that up. So what are things that you can add to it? I mean, obviously, you don't want basket cases who are going to suck up your time, who just happen to have money, right? That's the last thing
Right.
you want. You'll end up finding out like $1,000 a month is not worth this headache. It's just not. You know what I mean?
Right.
So you don't want people like that. You kind of want to find someone in the middle. You know what I mean? Um, so for the $1,000 a month, I think that you would really need to beef this thing up and put some integrative stuff into it. Something that you can actually give them. Like someone they want to hold something. They want something. There's the service, sure, but at the end of the day, I feel like they're gonna need a little bit more of something. So like from a mental health standpoint, can you do some more integrative things for them? Some supplementation. You actually give them the supplements, you ship it to them. Can you do some, HRT kind of stuff or thyroid or whatever for their mental health? You know what I mean? You're gonna have to do things like that. I feel like if you want to really get that number up,
Yeah,
you know.
that's a good
So
idea, and that's very pertinent because a lot of times I get guys in their late 30s, 40s, 50s who are starting to experience some of those like hormone changes, side effect stuff, or effects that happen as a result of that. So yeah, that's a good idea.
yeah, yeah, I think that's what you want. I think that's what you want to focus on. Like I've toyed with the idea of trying like some thyroid stuff to see if it helps a little bit with my, mental health. I mean, I'm not depressed or really anything, but it'd be nice to be a little bit more focused and a little bit more, up, I suppose. And so I thought about maybe trying some thyroid or whatever, low dose sort of a thing. But like, I would pay a little bit more if you were to manage that for me as well. Give
Yeah.
me some supplements as well, some lithium orotate and blah, 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 whatever. Right. So like, I think that's what you're gonna have to try to think of. Now, another thing you can do too is, um, there's high ticket executive physical kind of stuff. Okay. You can think about offering those services in your practice. All right. I don't think it's against your scope to order some of these tests because they have anxiety surrounding their health. And I'm ordering these tests to alleviate their hypochondria.
It
Right. So
depends.
like a full body MRI, cardiac CTAs, like executive level care. You know what I mean? Like someone pays you $10,000 for an executive physical.
Mhm.
Okay. And you order the tests for them to complete the executive physical. Super comprehensive blood work, full body MRI, cardiac CTA, venous arterial ultrasounds. Like essentially what you're doing is you're basically just ruling out anything that they might have, right?
Yeah.
Clean bill of health, right? You could think about something like that to add on to your concierge high ticket kind of a thing as well. Okay. You could do comprehensive biometrics, mental health marker testing, whatever that you have to add value to it. It can't just be based off of this is the service. You can text me anytime that you need anything. Like it's going to need to be
Yeah.
more than that if you want to charge. Okay.
Okay. Yeah.
Yeah. If you want basic, like what you're kind of talking about, 24-hour service. You text me anytime. I'll typically respond within a couple hours, sort of a thing. Like, you can text me for anything that you need. You always get refills. We can make an appointment whenever you want. If you want to keep it just at that level, okay, I think asking for more than $250 a month might be a stretch.
Okay.
Okay. You want to go more the next level of 1,000, the real high ticket stuff. Then you're going to need to be thinking about the integrative stuff that you can order. You have to order through compounding pharmacies, like more of that kind of level of care, and then very comprehensive testing as well. And I don't know what some of that testing looks like from a mental health standpoint, brain MRI, blah, 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 blah. I don't, whatever it is that you can integrate into this to make it, to beef it up basically, to justify the higher price.
Yeah, yeah. I guess my only apprehension with that would be like I was taught that like if you're gonna order a test, you need to know what to do when you get the results of that if there's something abnormal. And I've got like a few years of experience working in emergency departments and like some other bedside experience at the psych hospital I worked at and Bridgewater State Hospital. But, I guess I'm a little out of touch with more like the medical skills, because I've been working as a psych NP now
Right.
for like a bit longer. So I have to, like, I don't know, either sharpen up or get certified in some things to be more.
Yeah, I don't think there's a certification for this sort of a thing. I mean, you
Yeah.
can buy a book like you can buy Peter Attia's The Art and Science of Longevity or something. You can buy like that
Oh,
book.
yeah. Okay.
Talks a lot about this kind of executive level care sort of a thing.
Yeah. I
You
like.
can look up like Brian Johnson, the guy that's trying to live forever, that kind of guy that looks like he's real pale, looks like a vampire kind of guy,
Oh,
like
yeah.
that guy. Like you can just watch his channel and just kind of copy his protocols, basically, right? But the thing is that if you provide this care, yes, right, you ordered it, you're responsible. Now, this is the thing about executive health, these real high ticket concierge kind of services, is that you don't you're not going to be responsible for it when they sign a consent and you're stating, I am just doing this from a health prevention standpoint.
Mhm.
Whatever comes up positive is your responsibility to follow up your primary care doctor to take the next step. Okay.
Gotcha.
Have something like that in your consent form. Or, if you're trying to justify $1,000 a month or a $10,000 price tag for this executive level physical, at the end of the day, dude, this isn't rocket science. The CTA comes back with an 80% occlusion of the left, coronary artery or whatever. I mean, what are you going to do? You send him to a cardiologist. Like, this isn't rocket science.
Yeah.
Like, you know, some mass is found on their pancreas, potential, could be cancerous or whatever. What are you going to do? Send him to a gastroenterologist or whatever. It's not rocket science. Just
Yeah.
refer him out.
Yeah.
You're not,
Yeah.
you know what I mean? Like, you don't have to, like, you're not gonna be the one that treats
Right.
it. You don't do that, right?
I'm not looking at
So,
school.
yeah, like you don't have, like, what I mean, you don't have to follow up with more advanced testing. If there's a lesion on the pancreas, as an example, the radiology report will say recommend blank blank test,
Uh-huh.
right? Recommend CT, CT with contrast of the pancreas, whatever. Like it'll recommend what the next test is. It's up to you if you want to order that or not,
Yeah.
or just tell them to go to their primary care doctor. Okay.
Okay.
So that's going to be up to you. Me personally, I don't mind ordering the next test just to, I don't mind doing that,
Yeah.
but I'm medical, so,
Yeah.
I feel more comfortable with it. But, you do have AI. I mean,
Yeah.
AI is the ultimate the ultimate MD supervisor professor,
That's been super
so,
helpful. Yeah.
yeah. So I don't know. Those are things to consider with the high ticket thing. I mean, do you have any questions, thoughts?
No, I think that's a great idea. It's something I've considered doing something like that, but yeah, you've given me something to think about there.
Yeah. Yeah. So think about it, man. I'd say that the low hanging fruit, the $200 a month kind of a thing, $250 a month, whatever you feel like is justifiable. That's super low hanging fruit. You add a page to your website. You
Okay.
start offering it to new patients, etc. Hey, by the way, we do have this program over here. Throw it out there. It'll be a trickle of people enrolling into it, and it's really no effort on your part other than putting a page up and
Yeah. So
offering it to people.
would this be something that you would recommend doing as like a DBA under my current thing, or just like you said, just another page on my current website?
No, I think I would try to make it a separate business in a way, just DBA.
Yeah.
Same bank account, EMR, same everything,
Yep.
right? It just looks like from the outside it's a different business, but in reality it's the exact
Okay.
same thing, right?
Okay.
The only thing different would be I'd maybe have a different phone number for it, So
Yeah. Yeah.
get a phone app and make sure it's just a different number. So that way, if people are calling that number, okay, answer it. Blank Diamond Psych Care, whatever, whatever you're going to call it.
Very.
So, yeah. So I think that's what I would do. So you set up a different, separate Google business listing, website, everything. If you want to, if you want to go that route, that's what I would do. If you are going to go the real high ticket route, the real high dollar kind of a thing, maybe doing these more, this comprehensive testing and stuff,
Wow.
for sure you will want to do that DBA. Absolutely.
Okay.
So, but I think I would just do it anyways.
Cool. Awesome.
Yeah.
Thank you.
Yeah. So just give it a try, see what happens, man. I mean, what's the worst going to happen?
Yeah.
You wasted some time making a website. Like
Yeah. That was easy enough to do.
with AI, man, you can get one spun up in 15 minutes. I mean,
Mhm.
So, um, okay. So then, any other questions about the high ticket stuff?
Probably, but like that's enough, I think, for me to think about for now.
Yeah. Okay. Yeah. I mean, you got my email. You email me if you have another follow up question. We can do another follow up episode if you want.
Okay.
Um, so, integrating some new services into your practice. So before you hop on the call, you kind of mentioned the, was it the TMS or whatever?
Yeah, that's another thing that I was kind of thinking about. I've got a colleague of mine. She's actually my friend Hannah, who she's the one who turned me onto your podcast, which, by the way, thank you, was an integral component in me starting up my business. I mean, the advice I got from you was so helpful, and I'd gone to the Billionaires event in St. Petersburg like a year and a half ago.
Yeah.
And that was great too. I got a lot of stuff out of that. One of the things is if you look on my website, I have my dog's on there now because he's the chief comfort officer. So he's also a tax write-off. All his vet expenses are a tax write-off, and it's legit.
Hey.
So thank you for that. Um, but yeah, so TMS, I I went to a summit by a company that manufactures TMS equipment, transcranial magnetic stimulation, and there seems to be a whole lot of potential for that. Um, it's already got some FDA approvals for like depression and some other things, but they're talking about like all, you know, going for more FDA approvals for all kinds of stuff like tinnitus, possibly like some addiction treatment. So, um, the medications we've got, they're great. They're the best tools we have, and some like psychedelic stuff is in the pipeline, which is awesome because there's so much evidence supporting that. But these things all come with side effects, right?
Right.
TMS, not so much. Like you don't have like sexual dysfunction as a result of TMS that you have with lots of SSRI medications. It's a possibility, right? So yeah, that might be an avenue that I pursue at some point too. But that's a big thing too, because like you buy the chair and that's expensive, and there's a lot more that comes with that too, right?
How much does one of those devices cost?
I don't know. Um, but it's a big number. It's over 100 grand. Um, and then there's like the summit I attended. There's like a software subscription that they offer as well, which is a great thing. Like you want to have that because that's what's feeding all the data to get like these other FDA approvals and stuff. So it's an investment for sure.
So, just quick tip about buying a very expensive medical device. Okay.
No.
This is gonna be totally applicable to you. Okay.
Mhm.
I couldn't tell you how many dozens of MPs who just got totally screwed by buying this. This is mostly gonna be aesthetics kind of machine, medical devices. So, but this is gonna be applicable to you too because it's the same concept. So they just get screwed. They buy it new, and then they finance it or whatever. Okay. Come to find out that when, a year later they say, "Hey, this isn't paying for itself. No one's interested in this laser whatever device,
Mhm.
this weight loss machine. No one's interested in it." And they go around, they try to sell it then just to try to at least recoup something from it. And they go to the market to try to sell it, and they find that there's other people trying to sell theirs too. And it's just like they're selling it for half the price they bought a brand new a year ago. So these things are like cars. As
Yeah.
soon as you drive it off the lot, man, 25% gone. Okay. So if you're going to go this TMS route, do not buy a new one. Okay. Look around. You can find one used. I guarantee you can. Okay.
Okay.
There's some mental health clinic that bought one and they're closing down and they need to get rid of this thing. Okay.
Right.
Could be a year old, could be a good brand. All right. Thing it barely used. Okay. So do your diligence with it. Do not get suckered in by some salesman who's trying to sell you on it. That salesman doesn't give two about your long-term well-being. He doesn't care. He wants his commission and he's going to go about his life. Okay.
Sure.
So do not fall prey to these sharks. These people are sharks. Okay. So don't fall prey for them. Just thank you very much. I appreciate you showing it to me. Let me think about it. Oh, well, no. Get the hell out of my office. I told you I'll think about it. Right. So don't get suckered in. But try to find one used. That's with anyone listening to this. If you're looking for a medical device, go look for one used. It's 50% of the price. It is crazy. All right. Just consider that. Now, if you're going to do that, I think that the TMS thing fits in very, very well with this cash-based concierge kind of thing that you're wanting to do. I think it'd be very, very complementary to it. I think it fits. I think it makes sense if you want to do that. So I think it'd be a great service to add on to it because it's a cash-based thing anyways. So you have a concierge package that includes 4 TMS treatments a month or whatever, however that works. Plus, red carpet, you can text me whenever you want, blah, 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 whatever. Right. So I think that's the way you're probably gonna want to go with that. If you want to go with it. I think it'd be a good value add to a concierge high ticket thing, but just be careful. I've seen people, literally have to declare bankruptcy because they financed a device for $150,000 and it just does not pay for itself and the business isn't doing well. Then they declare bankruptcy.
Yeah.
So I've seen that.
That's a bummer. I don't want that. Yeah, that's a good idea. Currently working from home. I love that, me and my dog Harley, but depending upon like the DEA, what they rule, I might have to eventually like get an office space for the controlled substance folks. So if that happens, TMS starts to make more sense for me at that point, right? So
Yeah.
yeah.
Yeah, that's the thing, right? We don't know what the hell's going to happen in December with the DEA. We have no clue.
Yeah.
No idea.
Right.
They could
Keep kicking the
I
can road.
yeah, it's frustrating to say the least. I think I highly doubt they're going to go back to the Ryan Height
It
shit
doesn't
from
make
2000.
sense. Why would you want to add another barrier to care for mental health? I mean,
There-
that's the total opposite of like, what, that doesn't make any sense. But
Correct. It makes no sense. And this has become the standard of care for the last 6 years. For them to backpedal on it,
right.
it would cause a uproar. Because I mean, they tried to do that back in like, what was it, 22 or 23, and then like there was this online forum. Please give us your comments. And it was like 100,000 people were like, "What are you doing?
People
fine.
Convenience of telehealth.
Correct.
It would take them more time to find a parking spot, come into the office for their med management follow-up appointment, than to just have a quick 25-minute telehealth appointment.
Right. So I wouldn't worry too much about that. You'll probably be able to keep doing what you're doing. Okay. So, but I feel like that if you do want to scale this to the next level, though, having a physical office probably isn't going to be a bad idea if you really want to take this to the next level.
Yeah. I wouldn't hate it. Like, I think a hybrid is the ideal, actually.
Yeah.
But yeah. So
for sure, hybrid is definitely the way to go. And so if you go get an office, man, I mean, you're making enough money to justify it. Okay. So if you wanted to do it, you could do it. Something simple.
Yeah.
500 square feet. I wouldn't have more than that. That's it.
I started to look into it, and to my surprise, it's way cheaper than I thought it was going to be to get some office space. So, it's probably in the future.
Yeah, I'd say it's pretty close. Yeah. Cool. Any other questions? Anything else you want to talk about?
This has been super helpful. Thank you so much for having me on. I really appreciate it.
You're welcome. All right. Well, I like to end the episode with you asking me a question. You have personal curiosity or question for me?
Yeah, I've heard a lot of people ask you some questions, and I know that you love hunting and fishing and your family life and all that. But I don't know if I've ever heard anyone ask you this. So, what made you decide to become a nurse?
I don't think anyone's asked me that question in the 3 or 4 years of doing this. Yeah, that's a good one. Honestly, man, I just needed a job. I mean, I hate to say that, but you know, I graduated with my bachelor's in biology and chemistry.
Uh-huh.
Okay. 3.6, 3.7 GPA. I mean, I did well, you know. I took the dental admissions test and I was studying for the MCAT, never ended up taking the MCAT, but yeah, I took the dental admissions test. I scored pretty well. I never applied to dental school. And I got out from undergrad, so I graduated. I would have been, oh hell, how old would I have been? I would have been like 22 years old or something, right? I was still a punk kid. And so, uh, you know, partying and women and all that kind of stuff was my priority at 22, 23 years old. So, uh, you know, working out, whatever. So I did not, you know, so I took like a year, year and a half, 2 years off, kind of right in that range after I graduated, working bull jobs, you know, like bartending and working at a hotel and just stuff like that.
Yeah.
And I was like, man, I'm better. I'm more than this. When you start, you know, when you're working with people like that after you're educated,
Yeah.
you just start really realizing how, I mean, this might sound like a real thing to say, but like you really just start realizing how ignorant and dumb the general population is. Just can't stand working with these people anymore. I'm like, I'm beyond this. I hate it. That's just how I felt. Like, I'm beyond this. I'm just beyond this, you know? So I was, I need to do something. So I just started looking online kind of in my area and, it was, East Tennessee State University had an accelerated BSN program and my buddy that had, graduated kind of with me, I was like, man, we got to do something, dude. What the hell are we doing? Like, we're just messing around. We're not doing anything with our degrees, you know? And so anyway, so we like, this accelerated BSN takes a year and a half to do. I was like, okay, you get out, become an RN. I was like, oh, I don't want to stay an RN. I want to become a nurse practitioner. I'm going to go straight through, become an NP.
Oh, nice.
Yeah. So did the accelerated BSN, graduated, had about 6 months off from the BSN to my MSN, but I worked full time as an RN throughout
Yeah, yeah.
from when I graduated until I graduated MB school. I worked full time.
Yeah,
Still.
same.
I went to school part time. So it took me 3 years to get my MSN. So, but anyways, a long story short, I needed a job. I needed to just kind of break out of what I wanted, you know, break out of the situation I was in. And Accelerator BSN was a quick route to do it with the end goal of becoming AMP because it's, you know, I kind of always wanted to do something in medicine. You know,
Nice.
I was money motivated. I hate to say that, but oh well, shoot me.
Yeah. So is the rest of the country.
I think a lot of people are, you know.
Yeah, yeah.
Yeah.
Yeah, you know, obviously you made a great choice and money motivated, but like huge bonus that you get to help people in the process of making a nice life for yourself, your family. So
Yeah, 100%, man. I've always liked helping people. I just like I'm not a very good uh I'm not a very compassionate person. I'm just not. Like I'm not the type of person that'll sit there and hold your hand in the hospital bed. I'm just not. That's why I always worked like ER and stuff, treat and street, you know.
yeah,
I'm just not like that. I mean, I'm a caring person, but in a different way, you know what I mean? So like elite MP and doing these things has allowed me to help people in the capacity that
yeah,
I like to help people. You know, I don't necessarily like to help people in the healthcare sense. I'm just not. I don't know. It's just
I
that
feel you.
compassion component of it is something that I kind of just lack, you know. But I like helping people in like this fashion, you know. So I mean, everyone has their gifts, right? So
Yeah. Well, thank you, man. You've helped me out a lot. So, like I told you, you're my NP entrepreneur god. So, yeah,
that was a pleasure, man. All right, well, let's do a follow up once you kind of think about the whole, you know, the whole high ticket thing.
cool. Okay. Thanks, Justin.
All right, man.
Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcast. The content in this podcast is copyrighted by Galaxy Medical Southwest 2023 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.